Hi guys, my name is Rika Perry and I'm here to talk to you today about breastfeeding. I am actually a mother of two and I did not use the method of breastfeeding because I didn't know a lot of information about it. Breastfeeding is one of those things that doesn't really get talked about. It's kind of an awkward conversation for a lot of people, so it doesn't usually get talked about, and a lot of people don't know about it. So it can help you not only if you're a parent, but it can also help you if you're a friend, an aunt, an uncle, a grandparent. It can also help you for when you have your own kids in the future. So today we're going to talk about three things: the baby, the mother, and how it can help you save money. So when related to the baby, this is the part of breastfeeding that most people choose because you do want to protect your baby. You do want to choose what's best for your baby. So they it can actually help lower the risk of infection for your baby against like different things, infections and respiratory, everything. There's a lot of things that it can lower. So the first thing we're going to talk about is SIDS. SIDS is also known as sudden infant death syndrome, and this is an unknown but extremely common and one of the scariest and largest killers of babies, not only newborns but all the way up until 9 months. So I say all the way up until 9 months because the baby's respiratory and immune system are not developed and they cannot use their own antibodies until 9 months. So, and from like in the womb to all the way up until 9 months, their antibodies are very, 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 very low. But in the womb, they take stuff from the mom and their antibodies build up. But once they are, once you give birth, that goes very, very, very low again. So breastfeeding helps protect against RSV. It is a respiratory virus and is a disease that causes inflammation in the lungs, which can be one of the causes of SIDS. Although the actual cause of SIDS is unknown, this could be a contributive factor. So between 2 to 6 months, like I said, the baby's immunity is very low. So when the antibodies go away that you've obtained from the mom, the baby obtained from the mom, it leads to a very high risk of infection. So the milk actually fills the gaps for the antibodies that the baby hasn't developed yet. So that's how it can help against the respiratory. So milk gives you the extra antibodies that you wouldn't get from, per se, you wouldn't get from formula. You would get it from the mother's milk. Another infection or disease that can help is eczema or atopic dermatitis. And what eczema is it's rashy, patchy, patchy rashes on the skin. And breastfeeding doesn't prevent these, but it does lower the risk. And there are a ton of vitamins and nutrients in the mother's breast milk that can help fight these infections. One being the production of vitamin D and vitamin C. These, among a ton of other vitamins, give your baby the added immunity that they lack at the early stages of life and can also make their skin a lot tougher, not in appearance or touch, but under the surface. It's a lot less to get infected and, have all these bumps and stuff on their skin. With the breast milk. Breast milk can also help with reflux, which is our third we're going to talk about, and other gastrointestinal issues that can cause discomfort and irritability. GER, or a certain type of reflex, is lessened with breastfeeding due to the fact that the human milk is emptied faster from the stomach, which leaves less time for the milk to upset the stomach. Also, it has been related to life-threatening events. Also linked to our our main point of SIDS, breast milk could reduce the chances of this significantly. So not only does it help the baby, but it also helps the mother. So it's really interesting to see how it helps the baby, but the mom can benefit as well. One of the things the mom can benefit from is going to be losing pregnancy weight. One thing that we all dread is losing our pregnancy weight. Well, breastfeeding burns extra calories that promote weight loss. Your body layers on fatty tissue when you're pregnant, so have enough fat fat stores to begin and support breastfeeding. This is learned from the WebMD under the parenting page, last updated June 2014. Your body also naturally burns calories to make the breast milk every single time you nurse. So that's calories. Every single time your baby eats, you're burning calories. This is a natural way to shed pounds without changing any of the nutrients you or your baby are receiving. But keep in mind, a healthier diet is key. So you can't eat all these unhealthy things and still still expect to be super, super tiny. But you can shed some extra weight after burning the calories of breastfeeding. Also, it can protect against breast and ovarian cancer and other diseases for the mother. So estrogen levels are lower during lactation, and it has been thought that low estrogen levels promote the stimulation of the uterus and possibly breast tissues as well. So this gives a lower chance of the tissues becoming cancerous. Osteoporosis is defined as a medical condition in which the bones become brittle and fragile and from loss of tissue, typically as a result of hormonal changes or deficiency of calcium or vitamin D. This is learned from Wikipedia under the search term of osteoporosis and last updated of December 2015. Okay, you are less likely to suffer from osteoporosis due to the immense amount of vitamins your body is making, and the hormonal changes are offset by the benefits of breastfeeding. Our next point is that it is Mother Nature's birth control. So your body actually does not ovulate. It delays ovulation while breastfeeding, so it makes you technically unfertile, which means it's almost impossible to conceive during this period. This is your body's natural way of birth control. Basically, it's saying, hey, we're not ready yet, so it delays your need and want, your body's natural need and want to procreate. It also tricks your body a little bit into thinking that you're still pregnant by offsetting these hormones. So you're basically full capacitated. And as much as we like to learn about the medical side of things, we also like to learn how it saves us money. Because babies do take a lot of money, as sweet and adorable as they are, they do take a lot of money. So it's also really good to learn about how it can save some of that, put some change back in our pocket, right? So, it can help, breastfeeding can help you save the mother and the family, the whole family, because all the family and friends contribute to the mom and the new baby, so it can help save everybody money. It saves you money on formula, bottles, and the cost of water in many ways. So it saves you money on formula. Breastfeeding cuts the cost of formula almost completely, if you're not supplementing, almost completely. Which a can of formula can range anywhere from $8 to $20 to $40 depending on what your baby needs or what vitamins they're not getting naturally that you need to supplement. So sometimes your baby won't always finish their bottle, so you have to throw away that milk because you can't save it if they've already eaten it, you've warmed it up, everything like that. You can't save it, it'll spoil. So you have to throw away that bottle, well, the milk inside the bottle, which is essentially, that's money that you're wasting or losing. And you save money on bottles. Bottles can be very expensive because that's where we try to get the most breast-like nipple that our baby will like and go to. So when breastfeeding, you don't have to buy bottles, which saves you a chunk of money. When the bottle gets old, left out, broken, you then have to replace them, which is additional money spent on bottles. Also, breastfeeding can save you money on water. I know water, everybody's thinking is free, but it's not. Water bills, even if you don't have access to clean water, you have to buy filtered water from the store. Even if you have to buy a water filter, stuff like that all contributes. So you don't have to use the water that is required to wash the bottles, so this saves you money on your water bill. Then you also don't have to buy different filtered waters or buy a water filter to make the bottles. You are not supposed to use just regular tap water, but you can. I'm sure plenty of babies are fine. I've done it a couple times, but we are recommended to use filtered water. So that is a little chunk of cash, you know, that you have to use on filtered water that you save with breastfeeding. So I hope that I taught you a little bit about breastfeeding. We learned about, you know, a little bit about the baby, the mom, and how to save a little bit of extra cash. And I don't know about you, but I'm very fascinated in the human body. We learned that something so natural like breastfeeding can help the baby, the mom, and your pockets. Hopefully this gives you a little information about and clear the air about the not so comfortable topic of breastfeeding. No matter what you choose, stay strong and power on mama because you are strong. So thank you, and come back next time.